Good morning, chairpersons and all the delegates present here. I would like to present our data regarding the treatment efficacy and outcomes in patients with autoimmune hepatitis. Now, since we all know autoimmune hepatitis is the most common among all the autoimmune liver diseases, although it constitutes less than 5% of the total liver disease burden, it contributes to a substantial morbidity in patients living with AIH. Now, what is reassuring to the patients that we have well-established treatment protocols with proven efficacy, albeit with its side effects. But what is not reassuring to our clinicians is that it is only 60% of the cases it is effective. And maybe the partial response is seen in 25 to 30% of cases. But what causes this heterogeneous response, we don't know. Historically, 3 factors that were shown to lead to non-response was underlying cirrhosis, increased ALT levels, and increased IgG levels on the baseline. So we decided to study the efficacy of the first line and the second line treatment, what factors really determine the treatment response, and what really affects the survival in these patients. We have maintained prospectively a liver cleaning database from January 2010 to 2023, and among it, 351 patients with autoimmune liver disease were screened, out of which 194 patients were diagnosed with only autoimmune hepatitis. We excluded patients who had an overlap with other autoimmune liver diseases and patients who were seropositive with viral hepatitis. So overall, in the final analysis, we could include 108 patients with a treatment record of 12-month duration. What we found was the median age of presentation was 41 years, with females constituting 74%, and concomitant autoimmune liver disease was present in 18% of these cases. Almost 50% of cases presented with cirrhosis, and among them 20% had decompensation on presentation. 30% of those patients were presenting with chronic hepatitis, 15 with acute hepatitis, and only 2 cases was presenting with acute and chronic liver failure. What we found was 80% of these patients, the overall patient, had a complete treatment response, and this was not at 6 months. We followed this patient up to 12 months, but 10% had a partial response and 10% were non-responders. So this is the treatment response along the first, third, sixth, and the 12th month. As we can see, almost 65% of the patient had a complete treatment response at the end of 6 months. When we followed the remaining patients, 15 plus patients were responded at the end of 12 months. But 10% of this patient had to be put on second-line therapy. As an institutional protocol, we put all these patients on mycophenolate because the experience with tacrolimus was not good. So steroid plus MMF was given to 10% of these patients, and at the end of 6 months, only 30% of those patients who had treatment failure in the first-line therapy had a complete response. Intriguingly, the patients, because of the side effects, when the clinician and the hepatologist decided to continue only on monotherapy of Azoran, which were 21.5% of patients were continued only on Azoran monotherapy, almost more than 90% of these patients, majority of which were cirrhosis, had complete response, and they were without any clinical event. A short survival analysis, we can see the maximum mortality occurred in the initial 3 months of the diagnosis, and at 6 months, the survival was at around 85%, which maintained till the end of the 1 year. So the maximum, we lost 17 patients out of this 108 patients, and all the mortality occurred in the initial 3 to 6 months period. So in univariate analysis, the 3 factors that we found non-responding was acute severe AIH, ACLF, and decompensation as a presentation. Now, these are 2 ACLF patients had undergone a biopsy. One of them had massive necrosis, confluent necrosis, and massive collapse of the lobules. On the biopsy, that patient did not respond to the plasma exchange and subsequent treatment of steroids. But the other patient who had this really severe activity on the biopsy did respond to PLEX as well as future steroid therapy. And only factor that we consistently found on multivariate analysis as a response, as a predictor of survival, was complete response to immunosuppressant. Whether it is complete or partial, at the end of 1 year, they were doing well. Thank you.